So we've seen in our introductory video to the 3R's concept that the 3R's is a clinical framework designed to guide clinicians and exercise practitioners on rehabilitation following low back pain. And there are three different phases of the 3R's approach. The first one being the reactive phase, the second one the recovery phase, and the third one the resilience phase. So in this video we're going to look at the reactive phase. So the reactive phase occurs when a person has just had an injury, or in some cases just had a re-injury. And if we think of our analogy that we gave in the first video of cutting your hand and how do tissues heal, this would be the phase where the hand has just been cut, it started to bleed, and you've just got a little bit of a scab forming. The whole thing is inflamed, it's sore, and you're feeling a little bit of psychological pressure. You're feeling a bit of guilt, sort of, why did I injure that? What's going to happen to me? Questioning these things in your mind. And that's really what's happening in the reactive phase of low back pain. So we have three different approaches really, or three different aspects within our biopsychosocial approach to healthcare. We talk about the biological side, so that would be what tissues have been injured. We talk about the psychological side, the stresses and strains caused by the injury and the questioning that we have. And then we talk about the sociological impact. So how's that going to affect my work? How am I going to get to work? How am I going to get home, etc. And that's exactly what the patient is going through in this first reactive phase. So biologically, the tissues are inflamed, things are stiff, they're sore, we find that any movement is unpleasant, we can't get comfortable sleeping, we can't get comfortable sitting, we find walking perhaps irritates things. So at this stage it's a question of firefighting really. What can we do to try and calm those tissues down, to try and avoid things which are painful, but at the same time recognizing that there is a psychological aspect, so that the patient will be afraid, the patient is in pain, they're questioning, why has this happened to me, what can I do, what will happen with my work, will I use my job, etc, etc. So there's a psychological impact, and of course we've all got to live, so there's a social impact as well. So how are they going to cope with this injury? So what we have to do is to reassure them, teach them about how the body is going to react to that injury, do some things which can be relieving of pain, so it may be massage, it may be manual therapy, it may be taping, it could be all sorts of different things, and most of the research has shown that one is not necessarily better than another. But what we have to do as well is, while we are reassuring them, we must make sure that on the one hand we're identifying any potential serious things that could involve further examinations, so so-called red flags, and we're identifying things where the person may be a little bit fearful, so-called yellow flags. So if somebody is very afraid, we don't want to be telling them things such as, well, you need a scan on this, or this may cause problems with you playing with your kids. So that reassurance becomes more important to individuals who demonstrate these yellow flags. So things where they've got more anxiety or more fear than we would normally expect for a patient. So in our reactive phase then, it's reassurance, a question of protecting that area perhaps from further injury, of making sure that that person knows how to take care of themselves, so transfers, how do you get in and out of your car, what's the best way of getting into bed, what's the best way of sleeping, all of these things to allow the tissues to calm down so that we can gradually move into our recovery phase. And normally that may be a question of days, in some instances maybe a question of weeks, and sometimes what can happen is things can start to improve and all of a sudden you do a little bit too much, so we go from our recovery phase and we revert back to our reactive phase. So think about the reactive phase then of the patient needing reassurance and the tissues being easily stirred up. Okay, so in the next video we will look at our recovery phase of the 3R's approach.